Okay.
This is mine or yours?
This is mine. I have no idea. Okay, so we're going to go ahead and get started. I'm introducing Maria Trujillo. Is that how you pronounce it? Okay. She's the chair of the Blue Ribbon Committee on Human Trafficking, and she received a BA in International Relations from Claremont McKenna College and has a master's in International Communications from American University. She has also worked with DC Stop Modern Slavery in Washington, D.C., and the Human Trafficking Rescue Alliance. The Human Trafficking Prevention Task Force, and the Mayor's Advisory Council of International Communities in Houston. Her talk is entitled Human Trafficking, an Intervention Mapping Method for Health Professionals. Please welcome Maria Trujillo and let her speak.
Thank you all. I also happen to be the executive director of Houston Rescue and Restore Coalition, which is the one of the main anti-human trafficking organizations here in Houston. And what I'm going to talk about today is an approach that we took around the issue of trying to intervene with healthcare professionals on the issue of human trafficking. So this is just a little bit about Houston Rescue and Restore Coalition, who we are. We're a nonprofit organization. Our main mission is to prevent and confront modern-day slavery by educating the community, training frontline professionals on how to address the issue of human trafficking, and empower the community to take action, because we truly believe that every small action matters, especially on an issue as big as human trafficking. We are a coalition of organizations, so we bring together faith-based organizations, other nonprofits working in the field, or tangentially working in the field, government agencies, law enforcement, and so forth. So we really try to be big umbrella around how we bring people together to this topic. So today, what I want to talk about is how human trafficking is a public health issue, and that's how we framed our intervention around bringing healthcare professionals to the table. We want to talk about outlining the HERE training program as a model for victim identification for healthcare professionals, and explain the intervention mapping process that we use as it relates to the creation of the HERE training program. And then some conclusions about how it's gone so far as we've implemented it over the last several years. So human trafficking is a public health issue for many obvious reasons. Health issues with human trafficking victims are commonly ignored until they're critical or life-threatening. So if victims present themselves, they're presenting themselves to the ER at these very critical, life-threatening situations. They're living in oftentimes in dirty and crowded living conditions. They're receiving poor nutrition. As you can, I'm sure, imagine, if you're in a slave-like situation, you're not getting the proper nutrition, and you are having chronic problems in a variety of ways, and usually have long-term untreated issues and brutal psychological conditions. All trafficking victims go through much trauma, much to the same level as victims of torture. And for these reasons, we really saw that healthcare professionals are important stakeholders in being able to identify victims of human trafficking as they present themselves as patients in a variety of clinical settings. And when we did our literature review and kind of looked and researched at trying to prove this assumption that healthcare professionals are important stakeholders, one of the main body of literature that we found was that there's this pretty significant study that was done that found that 28% of victims came into contact with the healthcare system while in captivity, and they weren't identified. That's a huge percentage of potential intervention that could have happened and didn't happen. And so we saw that then that healthcare professionals played such a critical role in helping victims get out of their situation of slavery. And then many researchers since then has really backed up this overall study, and I've heard it with many other nonprofits and other organizations that work with victims, that oftentimes victims do present themselves in the healthcare system but don't get identified. So because of this information, we decided that there needed to be something done in terms of getting healthcare professionals involved in the fight against human trafficking. We did a lot of research and tried to find out if there was anything out there around this issue in training healthcare professionals. And at the time, back in 2008, 2009, there really wasn't anything out there that really provided a holistic intervention with healthcare professionals. So we sought out to develop the HERE training program. which is specifically designed to provide the tools to healthcare professionals to be able to understand the issue of human trafficking and then identify a victim and then properly bring that victim to the appropriate services. So it's a 3-part training, and it's designed to, as I said, one, educate the healthcare professional on human trafficking. When we did our research, we found that there was very little knowledge with healthcare professionals on the issue of human trafficking, period. So that's where we really had to start from. Then we wanted to teach participants how to identify a victim specifically in a clinical setting, because that was the situation where they would most encounter a victim. And then we wanted to recommend policies and procedures that should be followed to connect that victim with appropriate services. So we wanted to try to make sure that it was institutionalized within the clinical setting, some policies and procedures, and we provided those recommendations through this program. The HERE training program at its current state is offered for free. It has CMEs through our partnership with Texas Children's, and it's available for physicians throughout the city. We have one main delivery method of this training program right now, which is an in-person facilitation. We are in the process of developing a web-based facilitation, because what we found is healthcare professionals have very limited time to dedicate to training, and our program, to keep the integrity of the program, is about 1.5 hours to 2 hours long, which is sometimes too difficult for healthcare professionals to provide that time. So we wanted to develop a web-based program where they could come to it and do modules at 20-minute intervals or what have you, and then be able to get the full experience of the training. It has an evaluation component. We have pre- and post-test surveys that we do, as well as a 3-month follow-up survey, so we could see how the healthcare professionals actually use what they learned in practice. The history of the HERE program, I gave you a little bit of the background on why we thought that this was an important thing to do, and I was lucky enough at the time when I kind of had this grand idea, had a wonderful intern who is at the UT School of Public Health, getting her master's in public health, who helped use this, the philosophy of intervention mapping as a way in which to develop the program. Audra Moore then actually used this idea and concept to be her thesis for her master's in public health. It started beginning with informed by key informant interviews from both the healthcare professionals as well as experts in the field. So we wanted to make sure it was well informed the way that we developed the training. And then as we developed the training over a year's time, we had a focus group of both experts and healthcare professionals really there helping us bounce ideas and making sure that we created a program that was applicable and that would be really utilized to the target audience that we were trying to go for, which was the healthcare professional. The intervention mapping process, I'm sure many of you know what it is like. It has several steps. It has the needs assessment, which we did to make sure that this was a need in the field. There's specific matrices that are designed. It's a theory-based method with practical strategies. Then there's a program development period, which was informed by key informants as well as our focus group, and then adoption and implementation, and then of course it has an evaluation component as well. This is the main body of what the program looks like. The theme is look beneath the surface and hear your patient. And HERE obviously stands for an acronym to help healthcare professionals remember the steps to take in going through the process of identification. We've originally wanted to use the word heart as a theme, and we were told by our focus group that if we use the word heart, that most healthcare professionals would think cardiology and would bypass our whole process of trying to get them to identify victims of human trafficking. We also thought HERE really lend itself to actually, encouraging the healthcare professional to really hear what their patient is saying, look beneath the surface, and understand that when they're saying, oh, I'm fine, it really means that there's something else or you need to dig deeper. So H stands for human trafficking, the health professional, to make that connection for healthcare professionals that they are a key stakeholder. E stands for examine history, examine body, and examine emotion. And we go through the steps on how to go about doing that when a healthcare professional is taking their history, what to look for. And then from that E, if you suspect the case of human trafficking, then you go to A, which is ask specific questions. And we had 3 key questions that we developed because we also understand that a clinical encounter between a patient and a healthcare professional is very limited. in terms of time. And so you need to be able to get down to the nitty gritty as quickly as possible. So in that limited amount of time, what are those key questions that you could ask to try to ascertain if this person is in fact a victim of trafficking? So we developed these 3 questions, and then R stands for review, options, refer, and report. The way in which we go through teaching how to use this method and this here kind of acronym is through case studies. This is the first case study that we present and show a missed opportunity. We now have all these case studies videoed, so we actually show a video of the entire encounter and then walk through what happened in terms of that missed opportunity. And then we have 3 additional case studies that then let the healthcare professional practice what they learn and go step by step on how they should intervene, which 3 different scenarios. We also wanted to make sure that each scenario represented a different type of human trafficking. Not all human trafficking is sex trafficking, not all human trafficking is labor trafficking. It's both men, women, children, foreign-born, and U.S. citizens. So we tried to make sure that our case studies represented the breadth of human trafficking possibilities, so you could understand in every single different scenario what you should do and what you should be looking for. These are the supplemental materials that we developed as part of the HERE program. On your right is a big poster that has a flow chart that goes through like the procedures of what you're supposed to do. These are posters that could be put up in a break room or somewhere nearby that helps the healthcare professional to remember what to do and take the necessary steps. On your left, we created little badge cards because we know in most healthcare settings you have a badge, and it would be easy to attach a badge that has all the pertinent information and numbers to call on your badge, and you could just quickly refer to it and look at it while you're encountering with the patient. Finally, I have some conclusions about what we've done so far. We've been implementing this program for several years now. Obviously, the advantages that we've seen is that victim identification is happening. It's a targeted approach for a specific population, so we really dug in and said what would be the best way to get healthcare professionals to play their role. And we've also been able to offer continuing education units to all physicians that participate in this program. So that was a great advantage to have that partnership with Texas Children's. So one of the disadvantages that we found in implementation of this program was the length of the training versus the healthcare environment. As I said earlier, delivering an hour and a half to a 2-hour program is challenging for us to be able to get that time. So we've had to spend a lot of time kind of creating that buy-in and telling people the advantages of why we need to have this time. And that's also why we're really working hard to develop that web-based program. And the other disadvantage that we found is that we have yet to be able to obtain continuing education units for nurses, CNEs. It's a much more difficult process to go through, but we're in the process of developing that as well and being able to both provide CME credits as well as CNE credits, which we think would add a lot of value to our program. We're now in the process of, by the end of this year, that we're hoping to create a Train the Trainers program, and we're going to start licensing this program across the country. We're going to start piloting in other cities in Texas, and we also have cities all across the country who's been asking us to provide this program to them. We have a partnership in Seattle and some other states, and they're wanting to take it kind of statewide or nationwide. So we're really excited about those possibilities and having this program duplicated across the country. And that is it. I think I speed through that in time. Thank you. Is there any time for questions, or you need to go?
Probably.
No? Okay. Well, thank you so much. And if you ever have any questions, this is my contact info. Thank you.